Hey, what's up, guys? I'm David DiMuzio.
And I'm Dodge Feeler.
Dodge is a nurse practitioner here at Dr. Daniel McGrath's office in Austin, Texas. And I want to ask Dodge about the three most common myths or misconceptions that he deals with when speaking to new patients about getting a hair transplant surgery. And for a little background, Dodge has been performing a lot of the hair transplant surgical process because basically, as a nurse practitioner, you can do everything a doctor can do with a doctor there, right? With Dr. McGrath here. So how long have you been doing the surgeries here?
I've been with Dr. McGrath for almost 5 years now, and it's been fantastic.
Wow, 5 years. So what are the three most common myths or misconceptions that you deal with when patients call you, and you do a lot of the consultations as well? So first one, you had mentioned something about finasteride. So what is that?
So, Finasteride's it's a DHT blocker, or it binds to the enzyme that blocks the conversion of testosterone to DHT. And a big misconception is that, you're going to have a lot of sexual side effects and a lot of issues. That's not entirely untrue. That it does happen occasionally, but the data shows pretty clearly that that's typically less than 2% chance of that. And anecdotally, we're doing 7 to 10 of these a day. And we maybe get a phone call once every 2 to 3 months, and often it's even just a guy gets in his head about sexuality and he starts thinking about it too much, and often after we speak on it, we were able to figure something out that works out where he's really not having an issue, and we see some great improvement in his hair.
7 to 10 anecdotally per day, 1 to 2 every couple of months. So so that's, what is that, between 200 to 300 a month probably. And then, and then basically 1 per month out of that is somebody mentioning side effects. I have only ever experienced one, I'll call it a side effect from finasteride, besides better hair. And it was when I got back on it one time years ago. And then I was in this very strange position with a woman, and it got in my head. And it was definitely that. Like, I know 100% because I've been on it ever since. I mean, now I've been on it again 3 years, and had none of the same issues, but it was like I just got on it. I was thinking about it. It was a bit of a strange situation anyway. And just the combination of all of those things, I was like, oh, is this affecting me in some kind of way? So I do think that happens a lot to guys. I mean, so it happened to me one time.
Yeah. One thing I always point out to guys is, you remember the first time when you're probably early 20s and you had a little too much whiskey, and that's probably going to affect you for a couple weeks after that. You're stressing out about it. Things aren't working right. So, it's easy for us to get in our heads, especially as men. Anything that's involving that realm, you start panicking a little bit.
Yeah, totally. So what would be the second thing that it's a misconception that you deal with?
One thing, though, that happens a lot is, when doing an FUE, patients have it in their head that, that hair is going to grow back.
An FUE, if you don't know, is when you use a small punch to extract the graft from the back of the donor area. So you punch it out, and then you take that and plant that hair on the top of the head, just in case you guys didn't know.
It's essentially robbing Peter to pay Paul. You're moving it where you want to move it. There are times that, you have a four hair follicular unit, and, maybe 1 or 2 of those grows back. That's possible. But ultimately, when you're moving that hair from the back to the, crown or the front, that hair is not growing back. It will be a very small scar, often not really even visible, but it definitely is moving hair from one place to another, and that will not be growing back. So
yeah. Some guys do think that when you're taking it from the back of their hair, you're taking it and then just transferring some of the cells or whatever, and then it's going to grow here, it's going to grow here. You just got hair everywhere. Like Dodge said, it is robbing Peter to pay Paul. So you only have so much donor hair that you can take from the sides of your head, and that hair generally will not grow back. I also do want to mention, because I've gotten just random comments over the years on this channel from guys that come across these clinics that claim that most of the donor hair actually all grows back. Have you talked to some guys with the same thing? But it's like this new marketing strategy that clinics claim that we'll take all the donor hair and then all the donor hair will grow back, and we can just keep doing that. And that is just not true at all.
Yeah, I've had a few patients mention that, and there are things that can be done, like injecting some different growth factors with the hope that maybe there's some stem cells in there where you will see some regrowth, but But overall, it's still going to be a misconception, and even if you do get some growth back, it's not going to be back to full growth.
So what is the third myth about hair transplants?
The third myth that really comes to mind quickly is, kind of expectations. A lot of patients come in thinking that they're going to get, that exact density that they had when they were 15, 16 years old. And while the transplant looks fantastic, it comes in beautifully. It makes it where you're really able to style it in a way that it's not going to be noticeable. It's absolutely still a cosmetic procedure, and often you're going to need two procedures to get close to that density, but we're never going to reach that same density that Mother Nature gave us when we were younger.
It's really important that you level your expectations and you have a really good consultation with a surgeon consultant that is very reasonable. A big problem with this industry is that because it's an elective procedure, there's a lot of selling that's involved in this, and a lot of surgeons and clinics trying to hit numbers of doing so many surgeries, and so it gets taken away from what we think of a doctor often being, which, like, a doctor or a surgeon is just supposed to take care of me, is just supposed to do medical things to improve my life. And unfortunately, there are definitely many cases where it doesn't actually improve your life. And part of that can come down to actually false expectations when sales of, oh, we can do this, we can do that, because people want you to get you in your chair and get the money from you. So you have to, unfortunately, I know it can be a little pessimistic, but go into a little bit with that kind of attitude and understanding that is definitely something that exists. But the top surgeons in the world that have been doing this for years and have great reputations, most of them are not doing that, fortunately, because they want to keep those great reputations, so they want to be doing proper surgeries. But there's still a large amount that are doing kind of surgery on anybody and anyone as soon as possible.
That's it's just being honest. I'm not a salesman. I'm a provider, and when I speak to my future patients, I'm going to tell them the absolute truth. And when I tell them that truth and they know the expectations, when they come in the chair, they're ready. They know what's coming. We've got plenty of before and afters, and they see that it's going to be an amazing product, but there's still limitations to it. Anytime you have a cosmetic procedure, you can look at breast dogs or whatever, and there's going to be limits, and it's going to stick out a little bit. Whereas, we don't do a manufactured hair design, so it's still it's very natural. It comes out very well, but there's still got to be some dampened expectations on some things.
Hope this helps you guys prepare for a very successful surgery. You really do not need to ever go bald these days, as long as you catch your hair loss early and you go to proper surgeons and clinicians and get proper consultations. It's really incredible. There definitely is hair loss hope.